Let's dive into this a little bit. So we got this press release yesterday, and a lot of times the great thing that we love about being able to do the show is that we can do a little bit of a deeper dive into some of just the headlines of the day. And lung cancer we wanted to talk about today because it is the leading cause of cancer deaths in Minnesota, also the United States. And we wanted to find out, what is the state of lung cancer right now in 2024 in Minnesota? This new report was just released today, has some encouraging news, kind of a mix. Pat McKone is Director of Advocacy for the American Lung Association. She's with us right now. Thanks so much for being with us, Pat. We appreciate you.
Yeah, thanks for taking up this really important topic.
Absolutely. So news is a little mixed here for Minnesota, as you'd imagine. Let's start with the areas where we can improve, according to the study. Annual screenings, the way I was reading it, were a little bit worse off than the national average. So can you talk to us about the screenings and what that shows you here in the state of Minnesota?
Sure. For a long time, there were no early warning signs of lung cancer, like a cough or, like we have with other cancers, of breast cancer as annual checkups. But we do have a screening test that is a scan, and we just need to get the word out about who is the primary target to get that screen. And it's people who have a 20-pack year history of smoking. And that means if you were a 2-pack a day person that smoked and you smoked for 10 years, that would put you in the category of 20-pack year. And even those that have quit and have quit within the past 15 years, I think there's a lot of folks that think, well, I quit 10 years ago, my risk is over. You still have a risk, and the screening would be really important. And of course, the age category is 50 to 80 years. So if we can increase that awareness and then people actually getting the scan, early detection is critical with any cancer, and for lung cancer especially. Too many people present when they already have a symptom of shortness of breath because a tumor is blocking an airway. So that could help get our numbers up.
And this is a really big question, and I'm sure the answer is complicated, but generally speaking, does insurance cover what people need to be able to detect lung cancer?
Well, the good news is Minnesota has a thumbs up for screening and also for biomarker testing. So should you screen and find out you have a tumor, we actually have state law that requires insurance companies to cover biomarker testing, which really enables the provider to get down to the cellular level of what type of lung cancer, and that drives the treatment option. So it's a really win-win. We've got a big thumbs up for that, and it's really an important resource in the treatment of lung cancer.
One of the other statistics that jumped out at me was that Minnesota is among the best in the country for keeping people alive after a lung cancer diagnosis. Can you elaborate on that just a little bit for us?
I sure can, because survival rates, we are in the top 10 in the country. So survival rates across the country have increased about 26% over the past 5 years. For 100 people diagnosed with lung cancer 5 years from now, 28.4% will still be living. In Minnesota, it's over 32%. So again, that goes to early detection, getting the treatment that's specialized for your biomarkers, and then access to care.
Okay, and speaking of access to care and some obstacles, one of the groups that's hit particularly hard by lung cancer is Indigenous people. So, they're the most likely to be diagnosed, is what I was gleaning from this. So what is being done now, or what needs to happen to start to turn that around?
Well, there's a lot of history of trauma with the Indigenous people, and treatment and early diagnosis, and we've got to look at the rates of using cigarettes are the highest for Indigenous populations in our state, and that is the highest risk for lung cancer. Second risk is lung cancer. So I think we need to get, partner with the tribes themselves in promoting screening and early detection, so that culturally appropriate messages and that support for taking those steps to get that diagnosis.
All right. Pat McKone, Director of Advocacy for the American Lung Association. A really important study for right now. This is how it looks right now in Minnesota. We appreciate your time. Thank you.
Thank you.